I came to New York City to work at the Hospital for Special Surgery and complete my orthopedic trauma fellowship. I then went on to do a fellowship, an AO fellowship in orthopedic trauma in Switzerland. My first job was in San Francisco at the University of California, where I was director of the upper extremity trauma service at San Francisco General Hospital. Following that, I moved to Houston, Texas to take a position as the chief of orthopedic trauma at Memorial Hermann Hospital in Houston, Texas, which is the largest level 1 trauma center, busiest level 1 trauma center in the country, and part of the University of Texas teaching program. I also ran the orthopedic trauma fellowship in Houston, Texas. My practice focuses on orthopedic trauma, which is fractures involving joints and bones all around the body, including pelvis and acetabular fractures, scapular fractures, and complications of that type of fracture management. In addition, I do focus a little bit on the hand, wrist, and elbow because of my additional training in that area. Within that, I tend to focus a lot on the traumatic injuries and the complications of those injuries. Anytime a patient presents with an injury, you've got to look at the problem and decide, based on your experience, what the best management will be for that patient. And it's not always surgical. Sometimes the best approach is not a surgical approach and to focus more on rehabilitation, conservative or non-operative management and rehabilitation. The nice thing about this practice in particular with regards to that is that our physical therapy is incorporated into the practice, and that affords us an ability to really communicate very closely with our therapists. And I think the key with successful therapy is really that communication. What makes Gotham City Orthopedics stand out a little bit from the crowd is the very personalized care and attention that people get. The model of this practice is to really give patients a chance to be seen quickly.